The condition I'm talking about is called neurogenic bladder. Now, a neurogenic bladder, the bladder is essentially normal, but what really happens is these children are born with deformities in their spinal cord. Either at birth, the spinal cord is open, which is called a myelomeningocele. And what happens is in utero, the spine and the nerves that go to the bladder and the bowel are bathed in amniotic fluid. This results in problems with the bladder and with the bowel. Now, what problems are we talking about? How do these children present? These children present with inability to empty their bladders. They also present with frequent paralyzing urinary tract infections, high fever, inability to pass urine, which is very distressing to both the child and to the parents. Among the most important things we do in neurogenic bladder disease is to do what is called a video urodynamic study. A video urodynamic study is a very specialized study that tells you that as you fill the bladder, what happens to the bladder? How does the bladder receive the urine? Does it relax like it should do normally and hold large volumes of urine at low pressure? Or does it function very fast, very quickly? Does it start leaking? If it leaks, at what pressure does it leak? If there is urine going back up into the kidneys, this reverse flow called vesicoureteral reflux, at what pressure does it happen? So we get a whole host of information from video urodynamics. And based on this, we give the appropriate management to the child, which in most cases is medical management, treatment with medicines. Or what we would recommend in children who cannot empty their bladders, we would recommend creating a channel using the appendix. The appendix is normally removed in what is called in appendicitis, but we have a big role for the appendix. We preserve the appendix with its blood supply and create a channel from the bladder to the skin through which the child can pass a tube, which is called a catheter, and empty the bladder frequently. So this is called clean intermittent catheterization. In our country, especially in the South Asian subcontinent, there is a huge pool of these children who are neglected. And therefore, the care of these children requires a lot of attention, which we are very happy to provide as a tertiary pediatric urology referral unit.